So thank you very much for having me here today. I'm really excited to be here and be part of the 125 celebrations. I can see all those people standing have a good blood pressure. They're not falling over, they're not hypotensive. You're all caffeinated, your heart rate's going, love it. So for the next 30 minutes, I'm going to chat with you about pharmacists perform physical assessment and the value of it, or what I perceive the value of it to be. I'm watching on the Twitter feed, there's a lot of questions, and people are like, what are you talking about? And where can pharmacy technicians fit into this role and that sort of stuff? So I'm happy to chat about that as well. And one of my goals here is to encourage all of us in the room to think forward. This is the future of pharmacy. This conference, we look back 125 years, Bob, and went back to the very first registrar in 1891, and I'm hoping to look forward. So some of the stuff we're seeing today may not be what we're going to see in 10, 15 years from now. And I encourage you all to think forward. Now I see the doors are shut and people are in the room, so that's fantastic. All right. Okay, as far as disclosures go, I have nothing to disclose about this talk. The only disclosure I have is that I'm a strong advocate that pharmacists must perform physical assessment in our jobs if we want to actually care for patients and be responsible for their drug therapy. And I'm very proud to say that the Canadian Society of Hospital Pharmacists have had a huge motivation and desire to push our profession forward, and they've pushed pharmacists perform physical examination and into a formalized course with Langara College in Vancouver. And for the first time tomorrow, actually we're moving it outside of the Lower Mainland. It's a pharmacist-only, pharmacist perform physical examination course that's going to Victoria. And so I'll be leaving after this talk to go home and be teaching in that tomorrow. It's a 4 weekends where pharmacists will learn the physical examination skills to effectively monitor patients for drug therapy. On that note, I do want to thank the college and the board for supporting that. Over the last couple of years, the college has provided funding and support for pharmacists to attend this course. And it really speaks to the vision that the college has and where the college sees our profession moving forward and the support that they've put behind it. So thank you to Bob and thank you to the rest of the college members for that support. So a live poll. Should registered pharmacy technicians be physically examining patients during their practice? So a large proportion say no, a very few say yes. 86% say no. And the next question is, should pharmacists be physically examining their patients during practice? So 3/4 say yes, they should be, and a small proportion say no, they shouldn't be. So what is clinical pharmacy? You know, we've gone to places, I heard earlier on, that pharmacists were in trouble for putting labels on pill bottles back in the day. And someone said that earlier on. Pharmacists used to be in trouble for looking at lab tests back in the day. And pharmacists used to be in trouble for actually going to the ward and coming out of that locked cabinet, or locked room in the basement of hospitals back in the day. And times are changing, right? The practice of clinical pharmacy is actually the practice of providing patient-centered care that optimizes medication therapy and promotes health, wellness, and disease prevention. And pharmacists broaden their role in primary care environment to include physical exam as a function of collaborative drug therapy management. And when you think about it, pharmacists, our knowledge, our expertise, what we do and know and what we bring to care teams in a collaborative fashion is actually knowledge. The knowledge of knowing when a drug's going to work, how quickly before it's going to work, how long is it going to be in the body and still work, when is it going to be eliminated, and who better to determine when the patient should see a response to that drug therapy than the pharmacist. But we routinely rely on others to tell us if our patients are responding to drug therapy. We ask the nurses, is the patient getting better or worse? We ask the doctors, are they having side effects due to the medication? But we have students with us on rotation, and they have to fill out these monitoring plans. I know Dr. Lowen's going to chat about that later. And we dock them marks if they don't do a good monitoring plan, because we are the monitors of drug therapy. But I'll argue, many of us in this room, many of us in our profession, do not feel comfortable monitoring our patients, assessing our patients. And if I'm in a code situation and I'm giving epinephrine to a patient or atropine to a patient, I know as a pharmacist when it's going to start working and how long it's going to last for. Therefore, I feel that I should be the one who is assessing their heart rate, their blood pressure, their urine output, et cetera, because I know how long the drug's going to work. And the thing I'm going to do is make you all very uncomfortable, by putting on a stethoscope. What just went through your mind? Who does he think he is? Does he think he is a doctor? Is probably what went through many of your minds. And I hear a little snickering, but that's probably what went through your mind. And I don't think I'm a doctor. I think I'm a pharmacist who wants to monitor my patients and take responsibility for their drug therapy. And I'm thinking I'm a pharmacist who does not want to rely on other professionals to tell me how my patient is doing. And I want to evaluate my own patients. Has anyone ever driven a car before? Okay. Has anyone driven into the beautiful sunsets that we've had? I'll say yes, okay. So where I'm going with this is you're driving down the road and you've got your partner beside you and the sun is setting and you got those lights coming up, you know they're there, and your passenger says to you, hey Sean, it's green, just go. It's green, go. Are you just going to go through the intersection? Or are you going to look to the side and try to find that little light on the side? Are you going to take off the gas and slow down and see the green light with your own eyes? Or are you going to trust them? For me, I need to see the green lights with my own eyes for some weird reason. But then again, I'm the guy wearing a stethoscope, so maybe I am really weird. I don't know. But I would argue many people want to see that green light. But in a professional context, many of us are very, very comfortable listening to someone else to tell us how our patients are doing. So here's Dr. Reg Smith. He works in an anticoagulation clinic to bring it from the beautiful scenic sunset to actually reality. He's by himself. He's a pharmacist that works at my hospital. He's by himself assessing patients for drug therapy, initiating drug therapy, and he needs to physically assess patients to see how they're doing. Dr. Rich Wanbon, one of the pharmacists working in the emergency room at Royal Jubilee Hospital where I work, he's the one responsible in codes for the administration of drug therapy. He's the one responsible to ensure that patients are responding to drug therapy. He's the one assessing the ECGs. He's the one who's giving the medications during a code situation, during a cardiac arrest in the trauma room. This is real practice. I'm not making this stuff up. If someone's in flash pulmonary edema, we're giving them Lasix. We tell our students to make sure you're monitoring urine output and edema as two basic things. How do they monitor urine output and edema? And respiratory sound and decreasing crackles and improvement in O2 sats, et cetera, they ask the doctor or the nurse. And to me, that's really, really sad. So I'm excited to see that our curriculum is changing, and I'm excited to see that many pharmacists are taking ownership of this idea, and they're performing physical exam as part of their routine practice. So back in 2005, 2006, I had the pleasure of taking a rotation during my PharmD program. It was 10 years ago, and Dr. Ed Dillon, who I see is over in the corner here, is one of the founding fathers of physical examination in pharmacy practice, and I'd say probably in North America. In 1999, I went to the Royal Columbian Hospital to do my residency under Dr. Dillon's guidance. And Dr. Dillon, he walks around the emergency room with a stethoscope. He's in that trauma room. This is 16 years ago. He's administering medications. He is where our profession needs to be. And here I am I took a rotation with Ed back in 2005 for a whole month, focusing on pharmacists perform physical examinations for the purpose of monitoring drug therapy. That's all I did for an entire month, was examine patients, not for diagnosis, but for the purpose of monitoring drug therapy. So what is physical examination? The word scares a lot of us. We do it every day in our practice. So those of you who have children or niece or nephew, kid falls down and hurts their leg, what do? You pick them up. You touch their leg. Does this hurt? Does that hurt? Does this hurt? If kid's unwell, what do? You touch their forehead. You take their temperature. But when it comes to our professional aspect of our practice, hands off. And I haven't understood why. So physical exam is just looking at observation and using some physical techniques in order to look at bodily function. We've all used pieces of physical examination just today by looking at each other. To be brutally honest, that's the first step, inspection. And it's a systematic process that we use when we're assessing our patient in a head-to-toe function. And we are all trained to provide a good history and gather a good history as we assess our patients, and physical examination is just a part of that. When you look at the pharmacist care process, gathering data is an essential part of what we do. Objective outcomes and measurements are an essential part of what we do. And follow-up and monitoring patients is an essential part of what we do. But for some reason, in the profession of pharmacy, historically, we have not allowed ourselves to touch the patient. And I've been fortunate my entire career. I've been in a hospital practice, so I'll put that out as a disclosure. I have not actually practiced in the community setting, and I know there's some logistical pieces in the community settings about pharmacists perform physical assessment. But I have to think those can be overcome if we want to take accountability for our patients' care and their drug therapy. When I look at working up patients, we're all trained: chief complaint, history of present illness, past medical history, medications, past medications, and then we always are trained to do a head-to-toe approach of how the patient is doing. And that is something that's absolutely essential if you want to properly evaluate our patients for their medication therapies. So I had the pleasure of presenting to the Canadian Society of Hospital Pharmacists at their AGM earlier in the year, and I asked 5 questions. I did a 2-hour workshop on physical examination, and I asked 5 questions to them. One of the questions were, why should pharmacists perform physical examination on our patients? And this is Dr. Greg Egan, who works in Vancouver in an outpatient clinic. And the answer that came back was astounding. When I summarized it all up, it was because it brings accountability, responsibility for drug therapy. It helps pharmacists determine the appropriateness of drug therapy. Pharmacists are very good with having an acute knowledge, an accurate knowledge of drug therapy, but it's adjuvant to that, to bring a different perspective to the drug therapy, and monitoring is absolutely essential. And when I look at technicians and our registered technicians, even 5 years ago, technicians were sort of just coming onto the scene. And then I look at where our technicians are today. I have, at our hospital, we have 2 technicians. We have about 8 in the health authority that are actually seeing patients. Patients book time with my technicians. They come in. They actually have interviews with our technicians. Our technicians are actively interviewing patients. And this has all transpired in the last couple years. So I can tell you today, yeah, technicians probably aren't doing a lot of physical examination with patients. But I see a time in the near future, 4, 8, 10 years down the road, where pharmacists are going to be caring for patients. Technicians are going to be assessing patients on the wards. There's going to be some sort of robot stuff running around doing all the dispensing piece. And as a profession, we have to move away from not the dispensing piece and the accountability and responsibility for the dispensing, but we need to tie ourselves to the patient. We need to tie ourselves to providing care to that patient and assessing that patient. And I see pharmacists and technicians, the new dispensary of the 2020s, if you will, is going to be on the wards. It's going to be in an area in your pharmacy where they have patients come and book time with you and your technicians. The technicians will bring the patients to you. They will take their vitals. They will auscultate them. They will assess our patients. and provide you the information just like a nurse practitioner would with a physician. Now, that's a crystal ball type looking forward. Who knows what's going to be happening? I'd be interested in come back for the 150th celebrations if I'm, well, I guess I won't even be around and working at that time. But anyway, that's another story. So the other thing is why should pharmacists not perform physical examination? The two things were turf war with the docs. Is that resonating with anybody? Turf war, and we're not trained to do so. I'm excited to see that the new pharmacy students are being trained to do so. Dr. Arden Berry actually did a paper a couple years ago and some research, and he looked and he found 35 pharmacists. Why? And he asked them the question, and then they did an intervention where they trained them and then asked them questions again. Have you ever been formally educated in physical examination? And the answer, 85% said no, haven't been formally educated. And in my practice, I currently use physical examination. Only 60% of the, 40% of the people said, yes, I do. And then they showed the most valuable stuff would be blood pressure, blood glucose. And then in the follow-up survey, have you used physical exam in your practice prior to the session? 60% said yes. And then the question is, would you take another continuing education session in future physical exam? And the answer was 100% of the people said yes. So despite taking a course, not all of them are using physical examination in their practice. And the questions I had on that were, why? And so one of the things that pharmacists are telling me is, well, I'm on the ward and I bring out those guessing tubes and put them around my neck, and I'm worried people look at me funny and they think that I'm a doctor. And my question to you is, all the members of the care teams that we work with, physicians, nurses, pharmacists, social worker, physiotherapy, dietitians, speech language pathologists, etc., which one of those people don't touch a patient? Dietitians insert nasogastric tubes in the areas I work. Pharmacists traditionally don't touch patients. But we're responsible for drug therapy. The most ubiquitous therapies that patients get in our healthcare system is drug, and we are responsible for it. We are the experts, but we don't touch the patients. So the barrier, 92% of the people said, I've never been trained to teach PE. I feel uncomfortable performing PE on patients, and it feels as though patients would be uncomfortable when I perform physical examination. So going back to 1976, Donald E. Franke had said, he was one of the leaders, the founders of clinical pharmacy, and he was lauded as pharmacy's man of the century back in that day, a huge leader in pharmacy practice. And the interesting thing is what he said is that pharmacists perform physical examination in 1977. It came into the curriculum. Enables pharmacists to be more competently monitor the patient. It improves the skills of observation and perception and data collection. It enhances the role of pharmacists on the care team, and it makes pharmacists a more valuable member of the team. It improves effective communication, and it is an essential tool for monitoring for adverse drug reaction and drug interactions, and it helps clarify the significance of information that patients give us. Past generations of pharmacists have been seriously hampered by their lack of physical exam. We are glad to see this new direction in pharmacy education. So 1977, I celebrated that day with a piece of birthday cake on my first birthday. And here we are 40 years later, and I'll argue we're in the same position. 40 years later, we rely on subjective data. This is 1977, rely on subjective data to collect methods for basic drug therapy decisions. And here we are, 2016, we're in the exact same. We talk to patients, but that's it. We talk to patients, which is a huge step forward. But we haven't made that next leap. The College of Pharmacists does say that physical assessment skills are required when trained to do so when assessing patients. There's a bunch of papers out there about pharmacists perform physical assessment. There's books written by pharmacists on pharmacists perform physical assessment, a guide for evaluating drug therapy by Dr. Long, pharmacist. Clinical skills for pharmacists, all on pharmacists perform physical assessment. And I'll argue as pharmacists, sometimes just want to fit in. And I heard earlier about talking the same language as the rest of the care team. And when we come and talk to a patient, and I'm talking mostly to the pharmacist at this point, to say, hey doctor, you know, the eGFR is 49 mils per minute, so the Cipro needs to be adjusted because the book I have says that at 50, if the eGFR is less than 50 mils per minute, that it actually needs to be adjusted because the book says that. That has a completely different landing on the physician than if you say, hey doc, you know this patient has a UTI, I've just assessed them, they're now afebrile, their heart rate is now normalized, they're looking good, they're alert and oriented, white blood cells are normal. I think we could probably stop the antibiotic. Don't continue giving them the drug if they're doing well and they're improved. But now you're talking the physician's language. He doesn't want to care what the book says. He cares about how his patient's doing, or she cares how their patients are doing, and we need to talk that same language. We talk about things that we are essential members of the care team. And in the hospital situation I'll talk about, I'll argue I want us to be essential members of the care team, but until we're there 7 days a week, providing care at all times and take ownership and responsibility for certain aspects of the care, we are probably not essential members of that care team. Because on Christmas Day, when the pharmacy is not open, on Christmas Eve, when the pharmacist is not there, care goes on without us. We need to change the way we practice. Some basic tools is what we use. It's not the end of the world to use a stethoscope and a hammer. And we talked about the same language already, how essential that is in order to get people to start thinking along the same lines and convincing docs that we actually are looking at the patient's best interest, in their patient's best interest. And when you look at patient care, one of the key things here at the bottom is physical assessment skills. And this is in the book for pharmacists, Clinical Skills for Pharmacists. It's essential that patient assessment skills are incorporated in practice. And they're not hard skills. Inspection. I've just performed the first one. It wasn't too hard. I stood here, I looked out, I inspected. You need to know what you're looking for, obviously, but it's not that hard. Palpation. It's where you touch a patient. You feel for stuff that's just under the surface of the skin. You feel for abnormalities under the skin. You need to know when something's not right, and you can refer on to a physician or refer on to another member of the care team. Percussion. For the musicians in the room who are quite happy banging on drums, that's basically what we're doing. It's a medical type of banging on drums to make the sounds, to hear what is underneath the skin. If any of you have hung a picture on your wall, you bang down the drywall until the sound, then you go to the other side, you bang, and then you try to find that stud and you put the nail. That's what you're doing. It's not hard. We do it at home to hang a picture on the wall. Auscultation is listening. Just listening for various sounds. We have to be trained what we're listening for. I'm not saying you can just go buy a stethoscope and start auscultating everything that walks through the door tomorrow. I'm not saying that. My purpose for being here today is not to teach you these skills. My purpose for being here today is to try to have you leave here. If you leave here today and go, man, that guy's crazy, what is he talking about? I will have satisfied my purpose for being here today, to get you thinking that, hey, maybe we should be doing something along these lines. Maybe our profession, if we really want to care for patients and become essential members of the care team, we should be doing something along these lines. I remember having a little doctor kit as a kid, and I don't know, maybe I was weird, maybe I still am, I don't know, but it's always been something you just want to care for people. And that's why I went into pharmacy, is I want to care for people. So pharmacist physical exam is basically an extension of what we're currently doing. We can make more confident decisions and more accurate decisions with more information. That's all it is information. Provides more information in making a decision. And it's essential for pharmacists to perform physical examination in the future as we get involved with more disease state management clinics, certified pharmacist prescribers, and as the clinical technician role changes and over time. I've got 3 minutes. So I'm very, very proud to have had the opportunity to be involved with the pharmacist physical examination course put on by CSHP and the College of Pharmacists of BC. There is interest from across the entire country for this course and for this change in practice. And I'm so proud to say that British Columbia is leading the way. And so thank you, Bob. Thank you to the College of Pharmacists. And if you guys go back to your stores and your practices and say, I watched this guy and he talked about pharmacists with stethoscopes and stuff, and the guy is crazy, I will be happy. Please do that. Go back to work and tell people that you watched this crazy guy talk about physical examination. And I'm happy to chat with anybody, and you're welcome to call me, email me. The future is ours to create, so go out and create it. Thank you.